Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Sharmi Mukherjee graduated with her bachelor's in physical therapy from India. She completed her master's in physical therapy from Loma Linda University and earned a doctorate of physical therapy from Northeastern University. Sharmi is certified in vestibular rehabilitation by the American Institute of Balance and has been working with patients with dizziness, vertigo, and post-concussion problems. She has been a practicing physical therapist in the U.S. since 2007.
Dizziness, vertigo, and fall preventions. By show of hands, can I find out how many people have actually had any of these three symptoms? Wow, quite a few. Okay, so I'm hoping to help you by the end of this talk, you'll have at least some idea on what's going on and where to get help from. Just to give you some statistics, falls are the leading cause of traumatic brain injury and bone fractures, mainly the hip. Falls are the sixth leading cause of death for the elderly, and 65% of fall-related deaths occur amongst individuals who are 75 years of age. Now, please don't freak out from the stats. The whole point of this talk is to educate you and to prevent this from happening. I mean, the whole point is so you know what's going on and can get help and avoid and prove that these stats are wrong going forward. All right, so I'm sure everybody's heard of equilibrium. We know that we have to have equilibrium in order to maintain balance. Equilibrium now consists of three main complex sensory modalities. I'm going to give you a brief idea of all three of them, so then we can discuss what issues can come up with them. So the first one being vestibular, then you have the visual, and then you have the somatosensory input. Let's talk a little bit about vestibular. We all know that vestibular has something to do with the ear, and the anatomy is actually fairly complex, and most of the times it's very difficult to comprehend what's going on. So let me give you a very brief overview. So you're seeing this entire piece here, that is your ear. You have the outer ear, you have the middle, and then you have the inner ear. Now, all your balance is actually controlled by your inner ear. Going forward, now this is the complex that you see that's inside your inner ear. This is the cochlea, which actually helps us with our hearing. Then you have our vestibulocochlear nerve. Then you have something called the utricle saccule, and then the three semicircular canals. Your utricle and saccule is what actually helps us maintain or gives us information about gravity and linear acceleration, whereas the three semicircular canals here helps us figure out where we are in space and any kind of head tilting that you do so it does not throw us off balance. Now, each of these semicircular canals, they have these hair-like cells in them. The fluid through the semicircular canals basically gives us an idea where we are in space. So what happens a lot of times is because of just sudden head movements or thrusts, there are these calcium carbonate crystals that move from the utricle and saccule into the semicircular canals, throwing off the hair cells and thereby getting us off balance and causing dizziness. This was just to give you an idea of how complex the inner ear is. And any kind of change in this anatomy can throw you off balance and cause dizziness or vertigo. The next we have is our visual system. Now, our eyes actually are very important in providing feedback to the brain so you know where you are in space. Any kind of wrong or incorrect information from the vision can actually cause a lot of conflict. For example, this is my example because I am extremely motion sick when I'm flying. What happens is my eyes are telling me that I'm not moving, whereas my inner ear is controlling this linear acceleration and is telling me that I'm moving. So my brain is confused because there are two different things that are happening, and hence I'm a little dizzy. So what helps is basically taking off the visual feedback. So closing my eyes actually helps with the motion sickness that I feel. The same is true when you're on a boat. And again, this is true for most people who are motion sensitive. Everybody is not. So some people who are fairly motion sensitive will have more symptoms of dizziness or vertigo than people who are not. And sadly, I am one of those cases. So next is your somatosensory input. Now, somatosensory input is basically sensation of touch, and we call that proprioception, which is coming from your feet and your lower extremities. So your body basically is giving you feedback, or your feet are giving you feedback as to where you are in space. If you're standing, if you're sitting, the base of the feet has a lot of nerve endings, which is telling your brain where you are. A lot of times with patients who have neuropathy, maybe from any autoimmune disease or diabetic neuropathy, this feedback is not very sharp. Your feedback is not coming to be very clear, and hence your balance can be affected because your brain is not sure where you are in space. So finally, the visual, vestibular, the somatosensory systems come together in order to know how your body needs to react. So all these three systems have to be in place for you to actually have good balance, not get dizzy, and not have vertigo. So I'm going to give you a little insight on what can cause these systems to fail. Now, they're fairly complex systems, as you realized. I mean, there are three things out of which the vestibular system, the anatomy itself, is fairly complicated. So I'm just going to review some very common conditions that we see in our clinic that can actually affect these balance issues. So let's go over each and every complex. So the first is your vestibular complex. So Meniere's disease, I'm pretty sure we've heard of that. It's fairly common. It can occur due to a viral infection or allergies, and usually ENTs will take care of that. But there is sudden hearing loss, and then you have this spinning, this weird spinning feeling from 30 minutes to almost 24 hours. It's fairly unpredictable how long it lasts, but it usually lasts up to 24 hours. Next you have is labyrinthitis. Again, it can occur because of bacterial toxins, because of the fluid entering the semicircular canals and, throwing you off balance. Again, there is a lot of spinning movement that you feel with this. Then you have your benign paroxysmal positional vertigo. This is because of the crystals that I was telling you. So even a small head thrust from, like a flight landing, you feel that jerk. Even that amount of thrust is actually enough to throw the crystals off into a different direction. Good news is, BPPV is very treatable. In fact, we can treat it in 2 to 3 visits if that is what we diagnose and that is the exact problem. With Meniere's disease, labyrinthitis, or any other diagnosis where you feel a lot of spinning, usually develops into weakness of the inner ear. So what we do in rehab is we try and get your balance to get better and the inner ear to get stronger. Then you have the visual complex. Again, vision is very complicated, and a lot of things can affect it. Macular degeneration, glaucoma, visual motion sensitivity, which is something I have when I'm driving through windy roads. I'm extremely sensitive to motion. Convergence insufficiency, cross-eyed, and some people have that from birth. Double vision, or diplopia as we call it, it can be caused by stroke or any kind of nerve palsy. Now what happens with all these conditions is the feedback going to the brain is not accurate because both your eyes are not seeing the same thing. And again, when that conflict is occurring, there is dizziness or balance issues. Most of the time it's one eye that is affected, but you never know. We have to evaluate and see how we can help that condition. With the vision issues, we do sometimes work with optometrists to see if they can do a little more vision therapy than we can. We definitely do some vision therapy, but obviously they are more trained at it. So depending on the condition, we will refer them out. Then you have the somatosensory complex. This, again, as I was telling you, your feet, it's your peripheral neuropathy you can have from autoimmune disease, diabetic or circulatory problems. Deconditioning, weakness, that could give you different feedback to the brain. Then biomechanical limitations, for example, somebody who cannot move their hip as well as they would, or if the ankle is fused, your mobility is limited, so the feedback going to the brain is not accurate. Then you have cervicogenic dizziness, which is something we check for also if you have lightheadedness, ringing in the ear, temporal mandibular joint issues, so we will check for all of that. And then, of course, there is other central nervous system disorders like multiple sclerosis, migraine, meningitis, trauma, and tumor. Dizziness, vertigo, and balance. It's a fairly complex system, which we as clinicians are still learning. The entire vision therapy was actually fairly a new introduction to me when I took a course last year. So it's actually changing the way we are treating patients significantly, and I think it's an ongoing process, so we need to keep learning to see what's going on. And even with the vestibular complex, the inner ear is so complicated, you actually, when you're doing maneuvers, you can't physically see what's going on inside the ear, so it's a lot of process still going on, research going on. So what do you do now? My head is spinning, where should I go? So this is why I'm here, to help you figure out how to go through this process. So you can definitely go to your medical professionals, your primary care physician, your ENT, neurologist, and physical therapist. I would say see who's available the earliest and then go see them. If this is a history that you have been dealing with, obviously go to your PCP and then talk to them and see how they can help you. But if this is something that's been going on for a while, come see us. We will evaluate and see if we can help you out, for sure. Let me tell you how the whole evaluation process works. So how does physical therapy help? So when you call us or come to our clinic, what we first do is take a complete intake form. We're going to give you like 4 or 5 forms just to figure out what it is that is going on. And as you saw, there are 3 main complexes that are affected. So we as therapists want to know what exactly is affected. Sometimes it's not just the vision or vestibular, it could be a combination. So we need to know what exactly is going on, so that history intake is important. I know it's a lot of work, but it's important. Then we go through a battery of tests. Obviously, we want to see if the vision is fine, if the inner ear is working, if balance is working. So you will be there for at least an hour so we can figure out how to help you. And then at the end, we find out, or we are on some kind of a pathway to figure out what is going on. If we think there is nothing we can do, we will definitely refer you out. But most of the times, if the patient is dizzy or has balance problems, there's something or the other that we definitely are able to catch on. This is what I was talking about, benign paroxysmal positional vertigo. This is actually fairly common. And again, just a slight head jerk or a head trauma or a concussion can actually cause this. The main symptoms are patients are dizzy when they get up in the morning, getting out of bed. And usually it's one side more than the other. That's your main symptom. And then after some time when you're sitting, the dizziness subsides. That's your main symptom with this condition. What we do is we have certain positions, and I'll give you an example. We do certain maneuvers to get the otoconia, that's what we call the calcium carbonate crystals, back into where they belong. They're not supposed to be in the semicircular canals. Because they're in the wrong place, they give incorrect feedback. So by this repositioning, we actually get the crystals back into where it belongs, and thereby reducing that conflict or that incorrect feedback that's coming from the inner ear. A lot of ENTs I know give patients this something called Epley's band. So you have like this band that you put on your head, and then this air bubble that you look at, and you're laying down and you're doing all these head movements. It's a little complicated, but it works. But the problem with this is, they're doing research, as I was telling you, and the probability of it coming back is much higher by this maneuver. So we do a lot of other maneuvers that actually the probability of it coming back is much less. This is just an example of what vestibular and vision therapy is. So maybe we can actually try it right now to see how many of you get dizzy. Let's go easy, okay? I don't want patients right now. So let's just have your thumb stretched in front of your face straight, and all you're going to do is a head nod. Now watch me for a second. Your eyes are going to be on the thumb, and all you're going to do is a head nod like you're saying no. I don't want you to go all the way. We're not checking neck range. I just want you to go in this direction, right, left, and based on the speed I'm giving you, okay? It has to be the right speed. It can't be too slow. So should we try it? If people think they're going to get dizzy, please don't do it. As I said, I don't want to take any patients with me right now. So yeah, ready? All right, and go. Right, left, right, left. Look at your thumb, not at me. Right, left, right, left, right, left, right, left. A little faster. Right, left, right, left, right, left, right, left, and stop. Did anybody get dizzy though? I mean, I was being serious about that. No? That's a good thing. That means it's called a visual ocular reflex is working. So that's what you need when you're, for example, walking in a mall, looking around. A lot of patients get dizzy with that. That's because that reflex is not working. The other one is, you need that reflex so you don't get dizzy, for example, when you're running, because your eyes are going up and down, but you're not getting dizzy if this reflex is working. So that's a good thing. Once this reflex is affected, those movements become hard. You get dizzy easily. You're driving through a busy street, you'll get dizzy. If you're walking into a busy location, you'll get dizzy. If you're walking into a movie theater, it could cause a little dizziness. Are we ready for some balance exercises? All right, please hold on to your tables. And as the picture says, all we're going to do is go on our toes and come back down. Go on our toes and come back down. That's it. Hold on to something stable. Maybe this is not the ideal picture because that chair could move. So hold on to something, maybe a kitchen counter or something that you think is not going to move. How's that feel? This you can do whenever you're standing, all day. This exercise is very helpful. It gets all your extensor muscles going and gives you an idea of where you are in space. The next one is actually a little harder. It's standing on one leg. So those who have balance problems, please let's not do this. Let's hold on to stuff, and we're just going to hold it, maybe hold that position for 5 counts. Let's see, 1, 2, 3, 4, 5, and then switch legs. 1, 2, 3, 4, 5, and switch legs. That was awesome. Everybody doing okay? So as you get better, you hold it longer. As you get better, you try to only have a single finger touch. You don't hold on with the whole hand. But that is totally up to you as you get better. Please be safe with these, okay? I'm just giving you ideas, but you have to be safe. That is going to be your call. Then we have hip flexion, hip and knee flexion, like you're marching basically in standing. And then moving your leg from side to side. Other two are just ankle movements in and out. Then you have bending the knee. With marching, you're going knee up. With bending the knee, you're going foot back. Yeah? And then you have seated knee extension, so just straighten your leg wherever you are. Just straighten your leg alternately. Tai Chi and yoga have known to actually be very good for postural stability because those are very slow, controlled movements, and it improves strength. So the stronger you get, the better balance you will have. All right, just a few tips on how to actually prevent falls at home. The first one, rugs. Let's make sure they are skid-proof, they have something at the bottom that will hold on, and that they are tacked on to the floor. Stairs, make sure your stairs are very well lit and they have handrails on both sides. Make sure you grab onto those handrails if you need to. Toilet seat, try and have a grab bar around. Bathtub, make sure you have a grab bar. Then again, in the bathtubs, make sure you have a non-slip mat because those are the places where most people tend to slip and fall. Wipe off any wet floors that you have in your house. Please do not climb on a step stool without support. If you can, just don't climb. Walk on flat and clean surfaces. and have somebody alongside when going outside the house if there is a balance problem. Most falls typically happen outside the house because the environment is not familiar, but there can always be falls in the house. But that's the reason I gave you these pointers, to make sure you are safe. Feel free to contact us to make appointments if you need to come see us for dizziness, vertigo, or balance problems. Our address and our phone number is out there. And with that, I conclude my talk today.